This topic is for you who were born to be inflexible or might be thinking that you have a poor flexibility. It's healthier to be tight and inflexible. Are you inherently tight or inflexible? Do you have any recollection if you're able to touch your toes or not comfortable sitting on the ground with legs crossed? Do you feel unfortunate that you are born tight, considering now that you are older? Do you still believe that if you are more flexible, you probably be healthier per se? Do you believe that doing regular stretch can make you very flexible? You're probably surprised about how can you be healthy when you are tight and inflexible. This topic is for you who were born to be inflexible or might be thinking that you have a poor flexibility. Or maybe you don't know anything about flexibility or where to position yourself with your present ability to stretch. Everybody have a different meaning of perfect or normal. Therefore, I will avoid using that term. Instead, I believe that we are all born unique and original, and that natural body frame also carries properties that matches each part of our body. There is always an inherent harmony that complement our body to function at its unique level. If you are pretty much born to be tight, then you probably have difficulty going down to the ground to sit with your legs crossed. You probably notice how others are able to comfortably just sit and cross their legs without any effort at all. As you get close to enter high school level, it is still difficult for you to touch your toes. Most of you probably failed on the toe reach testing in your physical education. Since you were young, it did not really affect you, but more or less you remember that moment of truth in your life. I want you to know that being born to be inflexible does not whatsoever put you to that negative connotation that you can't be healthy or fit idea. So what is the positive side of naturally inflexible and tight? For so many years, practicing as a stretcher and as our lifestyle continue evolving in such a fast pace, your body is doing its very best to compensate from the constant changes in application and approach in dealing with our daily life. Different type of body can respond differently from all external challenges, and that is why being born uniquely inflexible have advantage compared to its flexible body counterpart. So listen closely and pay attention, since what I am going to tell you next is something that is new. Not everybody knows that a person who is inherently tight and inflexible have low risk of getting the usual chronic low back pain. For some of you, you're probably surprised. For some with low back pain, they wouldn't believe what I have just said. I'm going to repeat that since I know this is something new for everybody. Here it goes again. Not everybody knows that a person who is born or inherently tight and inflexible has a very low risk of getting the usual chronic low back pain. We are talking about serious common low back pain here. Either it flares up with pain that you can't go to work, or you have pain and have been diagnosed with bulging disc or slip disc, most of the time with excruciating referred pain and radiating shooting pain. Inflexible people who always have difficulty of crossing their leg then sit on the floor are those who can have just the typical sore back, but not serious enough to be debilitating. I always include this question on how well they can sit on the floor with their leg crossed. It is very useful clue on how much or if stretching will work for you. Interestingly, most people who swear that they're always tight when they were young has no past history of being diagnosed with lower back disc problem. They even always add that they never had a chance and experience to bend over with straight knee and touch their toes. You might probably wonder, I am tight and inflexible, but I was diagnosed with slip disc. I agree to where you are coming from. You are tight and inflexible, but still you are diagnosed with slip disc or probably bulging disc. But if you can remember your younger years, I bet you have no problem crossing your leg and can sit longer on the floor. Your tightness right now set in or started after you develop your slip disc problem. Again, your present or current tightness started or set in after you develop your slip disc or bulging disc problem. You were flexible then, and this flexibility enabled your lower back to move more than the ideal range of motion. Therefore, your lower back was vulnerable to repeated stress injury that was not managed properly and was ignored, and most probably exposure to prolonged sitting if you are not an active person. If this is the case, your present tightness and inflexibility is brought about by the complication of your slip disc problem and not because you are originally inflexible. When you recover from a lower back pain, residual inflexibility from the complication of your condition stays in your body or lingers in your body, especially if you did not fully rehabilitate your body during your recovery. If you got your lower back pain from being active and got injured because of certain sports, that would be a different story. And this is not actually common. The most common slip disc cases are developed gradually from repeated stress and compression and happen commonly with average to very flexible people. Right now, this image is from my American Council on Exercise Health Coach Manual. It shows our body, the specific roles and natural function of each areas. As you can see here, lower back has one specific property, and that is stability. It means that our lumbar spine specifically should function for stability and not mobility. Stability representation here is related to other areas that is commonly compensating for every repeated stress encountered. So if you compared yourself with others that is more flexible than you, then it is logical that you have more immunity to slip disc problem. In order for you to have a slip disc, you have to have less than the stability of the lumbar spine. Structures supporting the lower back should be more mobile compared to a inflexible spine. So if you are inflexible since you were young and you are born with it, then the stability characteristic of your lower back is definitely more durable and lasts longer as you age. Even with overexposure to bending of the lower back or supporting muscle weakens due to prolonged sitting, your lower back definitely is tougher than a usual flexible lower back counterpart. Two things that can qualify you to be a high risk to slip disc chronic low back pain. First, you have to be inherently flexible or with more or less ideal range of motion, which means average. Extreme flexibility can have a higher risk as well. The best simple clue is the ability to sit cross-legged on the floor without difficulty ever since you were born. And past history of extreme flexibility, such as doing a split. Second, you should be very competitive or extremely active that requires lower back repeated arching, or the opposite state, a sedentary lifestyle, particularly the chair-bound lifestyle. In case you are positive that you are born to be inflexible, then you are less likely to be diagnosed with slip disc. Any current low back pain that you have would be muscular or mechanical in nature, or a previous acute injury or accident. The advantage and the bright side of being inflexible is having sore back pain that can easily be relieved by stretching properly and regularly. It is also uncommon for you to have back pain that will stop you from going to work. In addition, common injury like sprains and strain is less likely even if you are doing regular high-intensity training. But of course, the common muscle soreness will be experienced like everyone. So much for the positive side. What about disadvantage? You will get old. I will get old. Everybody gets old. Since I am average when it comes to flexibility, I will get tighter and inflexible slower than you, since I have more joint mobility with ideal range of motion. In your case, you are naturally tighter and inflexible, which means you have below average of flexibility or poor ideal range of motion. Therefore, your body will get tighter and shorter faster than me as you age. So you need stretching more than I do as you get older. Your physical performance will be also limited to sports that does not require too much flexibility. A good example is running. You can still play tennis and golf, but will always complain of soreness and tightness or difficulty moving. Does it mean that you will be immune to severe low back pain? Yes and no. Yes, you are less likely to have nerve-wracking lower back pain that involves disc bulging or slipping out, but you still have chances of severe back pain depending on how much hours of sitting you spend your day. You see, prolonged sitting is now the major cause of lower back pain, and people who are flexible with ideal range of motion are the one afflicted most. If you have that chair-bound lifestyle, you still have the risk of low back pain, but usually not the disc slipping issue that is debilitating and recurring. Your kind of lower back pain would be more manageable one, exercise-wise and lifestyle-wise. But spending the whole day sitting is not going to save your overall health. Based on my stretch practice and observation, the misery and agony brought about by slip disc or bulging disc is frustrating and debilitating to anyone. Amazingly, many have overcome the suffering and I see them going back to being active. It is indeed healthier when you are tight and inflexible in comparison to having a more flexible body with predisposed spinal disc instability. But the havoc brought about by the inevitable prolonged sitting position generation will not save your health. I hope you find this enlightening and gave you ideas on how can you better live your healthy life. There is always a good reason that you were not born to be a contortionist. Thank you for listening. This is Jace Lee. I am an active, isolated stretch practitioner.